I just am glad this place is here, and I hope that people who have an older dog will realize that you don't have to give up, especially if there are mobility issues, that there are things to do besides drugging, you know, or even surgery. So that's what I'm hoping, because I think this guy's real proof. Right, Nicholas? He's looking right at you. Yeah, he says, I'm waiting to interview too. So, but that's the main thing. I mean, it's just, we could have a dog that might no longer be with us, or that was crippled and miserable, and I have neither. I have a happy older dog who's enjoying his life. This is Nicholas. He's 13 and a half. He's a long-haired dachshund. He was a competitor for about 9 years in agility, and so, which is like a dog obstacle course. So it does take some strain on the body. Won a lot of titles, but as a result, along with that, it's like any athlete. It does take some toll on the body, on the joints. And so we started him with acupuncture, and then when Dr. Stramel opened the practice here, we moved here to have him treated here. And you know, at 13 and a half, he's still able to be active. He's still got energy and moving, and it has managed pain. He's just gets his acupuncture, and at 13 and a half, he's on that and one kind of a nutritional medication, not per se a drug, and that's it. And so for 13 and a half, if you multiply that by 7, which would be the human equivalent, that's pretty good, because a human that was his equivalent age might be on more things than 1. So the main thing is just seeing that an old dog can have a quality life. You know, they don't need to spend the last couple of years hobbled up or suffering, or, you know, not able to get up and down. He comes for acupuncture once a month. They'll use the laser, some on him, and then they prescribed one sort of what they call a nutraceutical thing that he takes once a day. And with that, I've got a dog who can still take short walks, who's happy, who's still interested in interacting in life instead of hurting and limping. And because he's a dachshund and they are dwarfs, they are more prone to orthopedic problems. So staying ahead of the game makes sense, but I just could not be more pleased. You know, if something tomorrow happened and he passed away, I would know that he had a great quality of life. And these guys really keep them going without having to just drug them, you know, with multiple drugs. They're very good. They're good at handling them. They're knowledgeable about different breeds because while dogs are still obviously have in common being dogs, there are some differences among breeds and things that come up. And their background and experience has really lent itself well to treating these guys. When I come here, I feel confident. If I needed to leave him here while he was having treatment because I had to go somewhere, I wouldn't hesitate. He likes to come. And the dogs are smart. They know associative-wise what it is. His reaction to coming here is different than coming to the regular vet for the annual things where they might do shots or draw blood. Here, he wants to run in the door because he knows that that helps him feel better.